Hi, this is Alicia Bright. We're going to apply the concept of immunity to multiple sclerosis. So there are over 100 autoimmune diseases. We're not sure why they happen. It seems to be a combination of genetics and environment, and they seem to be on the rise. So we're going to look at a couple of these, at multiple sclerosis and systemic lupus erythematosus. These are results of type 2 and type 3 exaggerated immune response. Remember, we talked about 4 types of exaggerated immune response, types 1, 2, 3, and 4. The autoimmune diseases are generally associated with types 2 and 3. So multiple sclerosis as an autoimmune response to the sheaths around the myelin sheaths around the nerves in the central nervous system, the spinal cord, brain, and also the optic nerve. The immune system attacks these areas and kind of eats away at them, and then it'll calm down and they'll heal over, and then the inflammation will happen again. That's part of the disease process, and over time, these nerves experience scarring and then destruction. This is generally a progressive disease that tends to have periods of exacerbation and remission. It's difficult to diagnose these things. Generally speaking, autoimmune problems tend to have rather vague symptoms at first. But what you might see with manifestations are problems with movement, sensory problems, problems with balance and gait, and emotional disturbances, psychological disturbances. So the picture on the right shows a little bit more specific illustration of where the damage happens. You can see the upper image of the nerve and the axon going out to the muscle. The white bubbles around it, that's the myelin sheath that's intact, and you can see down on the one below, the myelin sheath is damaged. There are plaques on it and scarring. And what happens is that the signal that's transmitted along that axon is disrupted. Imagine if you take the plastic coating off of an electric cord, for instance. You expose the copper wire underneath. That's going to disrupt the ability of that cord to function. And so you might not get the same electrical transmission that you would have. Well, the nerve functions kind of the same way. So you'll see a variety of symptoms. So as we said, it affects the brain, so cognitive issues. People tend to be very tired. They can be depressed. They can have unstable moods. Emotional regulation can be disturbed. They can have visual disturbances either related directly to the optic nerve in the terms of inflammation of that nerve, but also the muscles surrounding the eyes. So double vision, that where one eye drifts or both eyes drift, you can't focus your eyes as well. Or nystagmus, that kind of jerking motion that comes from the muscles in the eyes. People can have dysarthria, dysphagia, difficulty speaking or swallowing. Musculoskeletal problems can include not just weakness, but sometimes spasms, ataxias, uneven gait, difficult gait, unbalanced. And people can have bowel and bladder problems related to either incontinence or retention. So the onset of this disease, as I said, is often insidious, and it may take months or years for a good diagnosis or a real diagnosis. A lot of times people don't even seek medical attention at first because it's so vague, and so you'll need to question folks about their experience and sort of how long has this been going on, when is the first instance of this that you can remember, and maybe tease out longer history. Usually the diagnosis happens a long time after the first onset of symptoms. And as we said, sometimes the disease will affect different people differently because it affects the nervous system differently. Also, some people have a severe, long-lasting symptoms where the disease comes on strong and they go downhill pretty quickly. Others may have occasional symptoms, mild symptoms. They may go down progressively slowly, but most of the time, actually about 85% of the time, they have remissions and exacerbations. So they'll get a little bit better, and then they'll get worse again, and then they'll get a little bit better, and then they'll get a little bit worse. But ultimately, the overall trend with this is down. Ultimately, there will be a deterioration in neurologic function. But with good nursing care, actually, these folks can live a very long, productive lives. I know of someone who's had this for over 45 years. She was a mother of 5 kids, and her husband and her kids, they all took care of each other. And as she got gradually worse and worse, they took really good care of her. So she had really good social support. She had really good health care. She had support, medications, and good nursing care, and good advice. And she has lived a very long, productive life, even though she's gradually deteriorated and she's been in a wheelchair for over 20 years. Still, she's enjoyed her life and her family has enjoyed having her. She's the matriarch, even though she's lived with this disease for a long time. So it's not hopeless. It can just be well managed and allow the person to continue living a productive life and rewarding life. So what do we do for them? Well, it's really going to matter. What matters is how the person is experiencing the disease. What nerves are being affected? So we're going to deal with it on a very individual basis. So rather than getting overwhelmed by the idea that this is such a far-reaching disease, what we do is we go problem by problem, and we just find out how the person is functioning. So the focus is to retain the optimal level of functioning, to help them function as well as they reasonably can. Medications that are used include adrenocorticosteroid hormones and also glucocorticoids. They may include immune modulators, immune suppressive agents, and muscle relaxants. Remember, we said that they may have muscle spasms. And of course, if they're constipated, we'll treat that. If they have incontinence, we'll manage that. We manage symptom by symptom. Rehabilitation includes physical therapy, occupational therapy, perhaps nutritional therapy. It's very interdisciplinary. And of course, basic good care, nutrition, fluids, hygiene. Those basic things are essential to helping these folks live lives. So just a few fun facts about multiple sclerosis. About 85% of them, as I mentioned earlier, have relapsing remitting MS. About 3 times the number of women are diagnosed as the number of men, and this tends to be true with autoimmune diseases in general, tends to affect women more than men. There are over 1 million people with MS in this country, and they're typically diagnosed between the ages of 20 and 50, so in their most productive period of life. And about 80% of them have debilitating fatigue. So that's another thing that nurses can help support them in. And that's it for MS for now.